Hello, my name's Janet Whitney, and I'm Director of the Eating Disorder Program here at Sovereign Health in San Clemente, California. Today I'll be covering not only the symptoms and treatment of eating disorders, but also what we offer here at Sovereign Health. One of the reasons we're treating eating disorders is that it has the highest mortality rate of any mental health disorder. And as many as 50% of these individuals also meet the criteria for depression. Self-harm is part of eating disorders, affecting 25% of the people with eating disorders. And an individual can exhibit a wide range of disordered behaviors, resulting in the diagnosis of one or two or more eating disorders at the same time. So what we'll be covering today is anorexia, bulimia, and other eating disorders to help you understand the significance and impact that this disorder has on the population. We say that the eating disorder is a very complex mental health disorder, and it is not a lifestyle choice. It is not a lack of willpower. It often occurs with a substance abuse co-occurring problem, but it's primary that patients with eating disorders be treated independently to ensure that they have the nutrition and the care that they need in order to even recover from other symptoms and disorders that they may have. It is not only women that have eating disorders. Only 1 in 10 men and women with eating disorders receive any kind of treatment. This disorder has so much shame and embarrassment connected to it that many people do not seek treatment. We are coming up with a individualized behavioral health care for our patients regarding their eating disorders and any co-occurring conditions. An eating disorder, we call it like a parasite, and it manipulates its host into believing it's his friend, and it's slowly destroying that person from the inside out. I had a recent seminar that I called it Starving to Live, because these people are actually starving themselves and they feel like that's the only way that they can exist, but it's actually destroying them. There's a great psychological impact of eating disorders. We have talked about the eating disorder feeling like a friend to the person with an eating disorder, but what that does is it separates the eating disorder from the individual so that we can start treating the individual as a whole person and the eating disorder as a symptom outside the person. The eating disorder actually whispers about destructive behaviors that help them to cope with feelings of lack of self-worth. And because it's served as a purpose, just like many addictions in the person's life, it begins to be difficult to manage until the patient can then realize how much self-loathing and pain underlies all of the eating problems. That's when we can really begin to see improvement with the person that we're treating. The eating disorder is just really a symptom of what's going on inside the person. Sometimes it's, if they're anorexic and not eating, they're really trying to disappear from the planet. Bulimics feel guilty about eating and are so afraid to be overweight that they'll do anything, and it's very self-harming to be a bulimic by throwing up or using laxatives or over-exercising. We'll go over all of those different ways of treating or coping with a self-esteem problem. There's so much secrecy and isolation with eating disorders. It impacts families, friends, significant others, co-workers, and classmates. And we're going to go over the myths of what an eating disorder represents, but so many people are saying just go eat or just stop throwing up. And if it was that easy, we'd see people getting better. So what kind of specific types of eating disorders will we be treating at Sovereign Health? Right now we're treating an adult population of women, but we hope to expand that treatment. In San Diego, they're treating adolescents with eating disorders. So let's look at the DSM-5 definition. Anorexia nervosa is an intense fear of gaining weight or of becoming fat, or persistent behavior that interferes with weight gain even though at a significantly low weight. Individuals with anorexia nervosa are typically perfectionists. They often exhibit black and white thinking patterns and live in extremes, struggling with low self-esteem and low self-worth. They feel that their bodies are the only aspects of their lives they can control, and might restrict or purge without binging to manage feelings of anxiety, depression, and stress. So their coping mechanism, that's how it becomes their friend. Here are the warning signs of anorexia: weight loss, distorted body image, intense fear about gaining weight, preoccupation with weight, calories, and food. You'll see these individuals playing video games all about cooking and food, or they watch the Food Channel. If they do eat, they feel very guilty after they're eating. They can't even see the denial of low weight. They don't even see that they weigh less than what a normal person weighs. They have high levels of anxiety and depression and low self-esteem. Often what goes along is self-harm, and as the person progresses, they withdraw from friends or activities. They don't have the energy or the interest in other people. They have excuses for not eating, and they deny their own hunger to such a point that they're so divorced from their body that they don't even know the pain of starvation that other people can feel. They have rigid food rules and rituals. They have intense and dramatic mood swings. They may abuse laxatives, diet pills, or diuretics, and they may have excessive and compulsive exercise. There's so many complications from anorexia. Probably you've heard of amenorrhea, where they stop having their periods. They have a very slow or irregular heartbeat, low blood pressure, anemia, poor circulation in their hands and feet, muscle loss and weakness, dehydration and kidney failure, edema and swelling, memory loss. It's so hard to concentrate when you're malnourished, so they're disoriented and have memory loss. Because their bodies aren't functioning, they have chronic constipation. They have growth of hair in places that normally they would not have hair. Their bone density becomes very poor, and they develop osteoporosis. Often they lose inches in their height. They're pale skin or have yellowish skin tone. They have dull, thin and dry hair, skin, and nails. They cannot tolerate the cold. They have fainting and fatigue. So that was anorexia. Anorexia, think of restricting. You think of the people that are very, very underweight. A BMI of less than 17.5 puts you in a category of low weight. So what is bulimia? Bulimia nervosa is a recurrent inappropriate behaviors in order to prevent weight gain, such as self-induced vomiting, misuse of laxatives, diuretics, or other medications, fasting, or excessive exercise. People with bulimia are similar in characteristics to anorexia. They purge to regain a sense of control and to relieve feelings of shame and worthlessness following a binge. And what we talked about before is they may binge after, they may binge and then do some type of behavior to get rid of the food after every time they eat. In the diagnosis of bulimia in the DSM-5, it says that even just one time of purging is considered bulimic if you do that once a month. The people we work with do it so much more frequently than that, sometimes after every meal. So the warning signs: you'll see people binging, eating incredible amounts of food, more than you can even imagine. I've mentioned before that I've seen someone eat a whole jar of mayonnaise, a whole jar of peanut butter, several pizzas, and they're usually looking very light and frail, and yet they're eating all this food, although they can look of average weight too. They have secretive eating, and you'll find food missing. They visit the bathroom right after eating or in the middle of meals. They're again preoccupied with food, playing those same video games and looking at calories. You'll see great weight fluctuations as they do this, and self-harm goes along with this disorder. They may do excessive and compulsive exercise despite fatigue, illness, or injury. So they abuse laxatives, diet pills, or diuretics at times. There may be calluses on the back of their hands or knuckles from putting their hands down their throat to throw up. And again, there are great feelings of shame and guilt. There is so much self-criticism and low self-esteem going along with this disorder. The health complications with bulimia, especially if you're purging, you'll have heartburn and reflux. That you'll see them clearing their throat a lot because they've been throwing up. They have swollen glands in their cheeks and necks, broken blood vessels in their eyes or face. It gets very dangerous when they get electrolyte imbalances that can lead to irregular heartbeats and seizures. You'll see edema and swelling along with dehydration. Many of them feel like they're gaining weight just from drinking water. There are vitamin and mineral deficiencies from the constant purging. And again, gastrointestinal problems and chronic irregular bowel movements and constipation because of the disruption in the way they're eating. If they're purging enough, you'll see inflammation and possible rupture of the esophagus, tears in the lining of the stomach, chronic kidney problems and kidney failure, tooth decay and discoloration from the purging. And then they talk about what's a binge eating disorder. Eating in a discrete period of time within a 2-hour period, an amount of food that is definitely larger than what most people would eat in a similar period of time under similar circumstances. Individuals struggling with BED experience episodes of uncontrollable eating followed by feelings of guilt, depression, and shame. They typically feel numb while binging and do so to cope with stressors. This is different from bulimia nervosa in that those with BED do not use behaviors following the binge like vomiting, laxatives, or exercise. You'll see warning signs of the BED. Large quantities of food, they're eating that and they're not purging. They're eating when they're not hungry. There's a sense of lack of control over food behaviors. They're eating until uncomfortably and painfully full. You'll see weight gain and fluctuations, feelings of shame and guilt. They're self-medicating with food. They're eating alone and secretive eating. It's embarrassing to eat that kind of amount of food. They're hiding food. There are high levels of anxiety or depression and low self-esteem. The complications of BED are obesity, type 2 diabetes, osteoarthritis, lipid abnormalities, including increased cholesterol, high blood pressure, chronic kidney problems, gastrointestinal problems, heart disease, gallbladder disease, joint and muscle pain, and sleep apnea. There are other eating disorders. Pica is something where they eat non-food substances over a period of time. We've heard of people eating tar or chalk, different things like that. Rumination disorder, where they regurgitate their food over a period of at least 1 month, can be rechewed, reswallowed, or spit out. Avoided restrictive food intake. It's a persistent failure to meet appropriate nutritional and/or energy needs. And other specific feeding or eating disorders. The symptoms and characteristics of the feeding and eating disorder cause clinical significant distress or impairment in social, occupational, or other important areas of functioning. There's another category that's not been included in the DSM-5, orthorexia, which is characterized by obsession over clean eating and severe restrictions of entire food groups. You hear of people going on raw food diets and that's all they eat, something that's never cooked, totally raw. And I think that some people consider that healthy eating, where they've now come up with a diagnosis for that. And as we lead into that, there's also another category called disordered eating. This is not in the DSM-5 because many people have disordered eating. The people who are eating just raw foods or vegetarian, they may call that disordered eating. In health-oriented communities, it's just healthy eating, but it's characterized by abnormal eating patterns or food behaviors, including dieting, cutting out entire food groups, skipping meals, and obsessive calorie counting. Many people struggle with disordered eating behaviors without meeting the diagnostic criteria for an eating disorder. The difference lies in the severity and the frequency of these behaviors, as well as the distress caused by them. So I do think many people have disordered eating habits, but it doesn't interfere with their general life, it doesn't interfere with relationships, it's just how they decide to eat or not eat at times. Let's look at the myths, because there are many harmful myths that help keep people from seeking the treatment that we can give them here at Sovereign. And we're trying to stop the perpetuation of these myths and the resulting stigma for those who are trying to recover from eating disorders. Myth number 1, eating disorders are about vanity. This is not true. These people are not vain. They have so much self-hatred, so much self-harm, so much self-loathing. They're just trying to cope with their feelings of anxiety and depression and shame. And they often feel very unworthy of the nourishment that food provides. Their self-worth is often defined by the number on the scale, and it's just perceived as something within their control, not out of vanity. Myth number 2 is that you have to be underweight to have an eating disorder. I absolutely know that there are people walking around in many instances with eating disorders, and we have no idea that they have them because their body mass index looks like it's within the normal range, and yet they are doing some kind of purging, or they're binging at night, or they're doing something that we wouldn't even know is going on. Myth number 3 is such a dangerous one. It says they could just stop if they wanted to. If that was true, we would not need treatment programs. It would be almost like saying, you know, you're weak because you're an alcoholic. Yes, you need help to stop these behaviors, but alcohol and drugs you can give up and never touch again. Food is so different because you need a much more holistic approach, because you're going to have to eat in order to live. And even if we can restore someone to a normal healthy weight, they still may have the feelings of unworthiness underneath that we need to treat. So it's much more complicated. The other myth is that only young females get eating disorders. You know, we've had women up in their 40s, 50s, and 60s with eating disorders. Definitely we have males. They can represent as much as 25% of the population. They go much more undiagnosed than females. So it can affect anyone regardless of sex, ethnicity, or age. Treatment at Sovereign Health in the ED program will empower clients to turn self-hatred into self-love, self-harm into self-care, and self-destruction into self-acceptance. Our program's mission is to help individuals with eating disorders develop and maintain a healthy relationship with their minds and bodies. We will work to reverse disordered thoughts and behaviors regarding food and body image. Through individual and group therapy, we will arm ED patients with alternative coping mechanisms to manage stress and other triggers to reduce the risk of relapse post-discharge. We offer PHP and IOP levels of care. Right now we have a beautiful home with 11 beds available. We are currently serving females over the age of 18, but we look forward to expanding our care. The treatment modalities include yoga, equine therapy, art therapy, CBT, many family therapies. We try to include what we can to treat the whole person. And we're using evidence-based modalities to provide unparalleled care in the facilities nationwide. Each patient will have a treatment team at Sovereign Health that works together to help the individual achieve mental and physical health. It includes a primary therapist, a psychiatrist, a registered dietitian, and a case manager. Our dietitian creates an amazing individualized program for each patient. She will evaluate them, come up with a meal plan, educates each patient on nutrition, challenges them with existing beliefs regarding food and exercises, and works with patients to address their fear of foods and disordered behaviors, both on-site and at experiential food outings. So she'll take them to restaurants, even In-N-Out Burger or a donut shop or something like that, to challenge them with foods they may not normally eat. Here's a list of all our groups, from CBT, DBT, body image, family group, yoga. It's a lot to focus on the positive and get rid of the negative. That's what our focus is. I want to say that recovery from eating disorders is possible. This varies depending on the patient. Studies have shown the earlier they're treated, the longer they're treated, the better it is. So we're going to instill practicing intuitive eating and exercise, releasing them from their preoccupation with food and eating, developing body acceptance and appreciation, and also increasing healthy coping tools to deal with life's inevitable stressors or co-occurring conditions. And our focus is to maintain general physical and mental health. I'm very happy to be a part of this program at Sovereign Health, and I look forward to more programs developing through Sovereign Health across the country so that we can, as a group, help confront this very deadly disease that's hurting so many people, and it's actually growing in the number of people that are affected by this disease. There are statistics that say 80% of 10-year-olds worry about being fat, and also the median BMI for Miss America has gone from an average BMI of 23, which is at the top of the normal range in 1930, to an average BMI of 16 to 16.5 in the last 20 years here on the planet, which means that we're actually honoring and telling women that they're beautiful when they are diagnosably thin enough to be considered anorexic.
Major depressive disorder is one of the most acute, widespread illnesses of the 21st century, affecting nearly 15 million American adults annually. According to the U.S. Substance Abuse and Mental Health Services Administration, of that 15 million, 7.9 million had a co-occurring substance use disorder.
What depression is like. The best way I can think of now to describe it, that you're carrying 50 pounds of weight, but you can't ever put it down. As soon as you get out of bed, you're putting that weight on, and you're carrying it all day. It takes so much energy for me to get out of bed in the morning. A monumental effort to do that. And I think people probably think you're exaggerating, and like, how could it possibly be like that? But it is.
People have recognized changes in me through the deep TMS treatment. Before the deep TMS treatment, I used to have moments where I would go to a dark side and have dark thoughts. And now with the treatment, I don't have those thoughts anymore.
I don't wish depression on my worst enemy. Honestly, it's up and down and crying a lot and thoughts that I wanted to end my life. I'm a single parent. I didn't want to take care of my kids. I just wanted to be locked in my room, didn't want to do anything.
Major depressive disorders are traditionally treated with antidepressants. Too often, however, these medications fail to bring the hoped-for relief and are often accompanied with adverse side effects. Hi, I'm Suzanne Jesse with Achieve TMS in partnership with Sovereign Health. I'm here to introduce you to a brand new era in treating depression. If you related to the people in the video about the ups and downs of depression and anxiety, the struggles with failed attempts to treat your depression with antidepressants, you may want to consider the advanced technology of BrainsWay's deep transcranial magnetic stimulation, also known as DTMS. Before I introduce you to this cutting-edge TMS system, I'd like to first introduce you to the expert psychiatrist and medical director of Achieve TMS, Dr. Manish Sheth. Dr. Sheth has helped literally hundreds of patients find freedom from their depressive symptoms using deep TMS. It's Dr. Sheth's mission to offer this innovative treatment technology to everyone that may benefit from its use. So I'm guessing at this point you'd really like to know what exactly TMS is and how you can decide if it's right for you. Let's take a look at what TMS is and what it looks like by watching this brief video provided by the manufacturer of the system, BrainsWay.
BrainsWay Deep Transcranial Magnetic Stimulation, or Deep TMS, launches a new era in the treatment of depression with an effective, safe treatment. Our technology is based on patents filed by the U.S. National Institutes of Health and by the company. BrainsWay Deep TMS treatment utilizes a cushioned helmet, which is fitted to the head of each patient. Within the helmet is BrainsWay's H-coil, featuring a unique patented design. The unique structure of the H-coil performs magnetic stimulation of deeper brain tissues, generating a powerful impact on the mood regulation system. The treatment rebalances abnormal deep brain structures and causes substantial improvement in depressive symptoms. BrainsWay's treatment features high efficacy, which has been proven in various double-blind studies. The treatment is effective for a wide range of patients, including persistent cases of depression. BrainsWay Deep TMS has been cleared by the FDA for treating drug-resistant depression patients who did not benefit from the use of one or more types of antidepressants. The treatment has been shown to be safe and well tolerated.
Let's review the facts. BrainsWay uses a helmet with magnetic coils, much like the magnets used in an MRI. These magnets stimulate the areas of the brain that regulate mood. It's these stimulations that rebalance brain chemistry and structure to provide relief of depressive symptoms. It's highly effective. FDA approved for depression that has been difficult to treat with medications. It's safe and well tolerated. The sessions are 20 to 30 minutes long daily. Let's take a closer look at a couple of these items. When I'm considering something new and someone says, "It works, it really does," I like to have some proof. So let's take a look at what Dr. Sheth has to say about the effectiveness of Deep TMS.
Deep TMS is deep transcranial magnetic stimulation. It is the latest FDA-approved non-invasive treatment for those who have gone through multiple treatments of depression but have not been successful. It's a treatment which uses magnetic technology to stimulate the nerve cells in the brain, improve their electrical activity, and help in the treatment of depression. Now, as you can understand, no two brains are alike. So every patient who goes through TMS has a different level of threshold and different level of where the treatment is focused. A person has to go through 6 weeks of treatment, and periodically they get evaluation from the physician during this treatment, and majority of them, they start noticing an improvement with sleep as the first sign of improvement within first week. By second week, they start noticing an improvement in concentration. About 2.5 to 3 weeks into the treatment, they start noticing that their symptoms of depression are lifting. Suddenly they are feeling more motivated about doing activities with their friends, their family. They look towards tomorrow. They want to do things that they used to enjoy before when they were not depressed. About 4 to 5 weeks is where they feel that their depression has lifted to the extent that they start feeling maybe 70-80% of the normal. 6 weeks is where most of the symptoms have lifted.
We learned that it's safe and well tolerated. Dr. Sheth explains what this actually means and what other types of conditions may be treated with Deep TMS.
A typical patients drive themselves to the clinic. They get situated in the chair. The helmet is placed, treatment starts, and after 30 minutes, as soon as the treatment is over, they are ready to drive back home or to work. And that's the end of the session. And to add that, there are no side effects like the medications that are imposed on the body of an individual. For example, there is no stomach side effect, there are no sexual side effects, there is no weight gain, there is no excessive sedation or sleeplessness. At present, Deep TMS is FDA approved for the treatment of major depression, but there are several studies going on in our country, including that for OCD, PTSD, nicotine dependence, other kinds of substance use, and we believe that we may get one or more FDA approvals very soon. Now, if you look at the other parts of the world, across Atlantic, in Europe, it has already been approved to be used for schizophrenia, autism, Parkinson's disease, chronic pain conditions, so a variety of neurological and psychiatric conditions. And I think that's what is going to happen in future, where this will be a technology or a tool that will be used for a variety of conditions. The last revolution that we saw in the field of psychiatry was when Prozac came to market about 30 years ago. And I think TMS is bringing that level of excitement, and I believe this is going to be the next revolution in the field of psychiatry.
As you can see, having a Deep TMS treatment experience is quite simple. You can always expect highly trained, experienced, and friendly staff to make your experience comfortable. I always love to hear from the experts themselves so that I can understand more about what I'm considering. But what really makes a difference for me is when I hear from the people like myself that actually tried it. Oftentimes, when I see that it worked for someone else, it gives me confidence that it will work for me too. So let's take a look at a couple of people who have had deep TMS treatment and what it's done for their lives.
And after a couple of weeks, I had to fill out a piece of paper to say how I was doing. And I noticed that instead of having things that were not well being all the time, almost all the time, or more often than not, it started to move. That told me that I had really experienced something dramatic.
While getting the deep TMS treatments, I didn't feel any side effects. It was calming for the 20 minutes of treatment, and I felt good. There was no side effects whatsoever. I would recommend deep TMS treatment to anybody who's suffering depression. I can enjoy stuff that I didn't enjoy before, so yes, there's an option, there's something that grabs onto. So I would definitely recommend it.
Today I'm constantly on the go. I'm working at the school and constantly on the go. I've never had so much energy and been so happy.
I'm hoping that people will see me and know there's an answer. There's a solution. What medication and therapy couldn't do for me alone, deep TMS did. It changed my whole life.
Life transformations, that's our hope for you. If you think deep TMS may help you in your journey to reclaim your joy in your life again, ask your doctor or therapist if deep TMS may be right for you. From the entire team at Achieve TMS in partnership with Sovereign Health, we wish you health and happiness today and always.
We are going to be discussing naturally assisted detox, in short NAD. Today we will be discussing what NAD is, how does NAD work, who can benefit from NAD, what does one need to know about NAD, history of it, and who can receive it. NAD is a natural IV therapy used to help those detoxing from addiction to drugs and/or alcohol. What is addiction? Addiction is a condition in which an individual persists in the use of alcohol or another substance despite harmful effects on his or her health, work, or relationships. Chronic heavy use often results in tolerance. More of the substance is needed to achieve the same effect. Withdrawal symptoms if use of the substance is cut back or stopped. History of NAD. NAD has been around since 1961 in South Africa. The first addiction treatment clinic to utilize NAD therapy was located in Springfield, Louisiana. The center was founded by psychotherapist Paula and her husband Richard, who was a practicing psychiatrist at the time. After conducting intensive research into NAD therapy for addiction, they opened Springfield Wellness Center in 2001 and have since treated over 1,000 patients. So what is NAD? NAD is a natural assisted detox. It's also neurotransmitter restoration, nutritional assisted detox, medical assisted detox, rapid detox, a coenzyme that the body transforms into vitamin B3, a natural occurring amino acid, vitamins, minerals, and an important cofactor, NAD coenzyme 1. To make it simple, it's IV, which contains amino acids. What it does is improve brain function, cellular energy production, along with increased neurotransmitters. There is some withdrawal symptoms for 2 or 3 days, but reduced by 70 to 80% when compared to cold turkey withdrawal. After 3 to 5 days as withdrawal symptoms disappear, craving subsides and clarity of thinking is restored. Please keep in mind, it is not a substitute to recovery. What does NAD do? It repairs damaged cells caused by drug use. It reduces cravings. It provides clarity of mind. It reduces physiological and psychological stressors. It strengthens the immune system, decreases withdrawal symptoms by 50% or more, It reduces chronic fatigue. It decreases anxiety and depression. It raises the level of dopamine and serotonin. Can NAD help our patients? Yes, it can. It can help an individual discontinue the use of drugs and alcohol and repairs the damage caused by chronic use. It restores the brain. It is drug-free. It's naturally assisted detox with natural occurring amino acids, vitamins, minerals, and an important cofactor, the NAD coenzyme 1. It improves fatigue, anxiety, depression, normalizes stress level. It restores mental clarity. It renews a sense of well-being or optimism about engaging in the next steps of a larger recovery program. Our clinicians provide individual therapy to patients in the NAD program. We make sure that the clinicians are using the evidence-based cognitive behavioral therapy approach, dialectical behavioral therapy, and solution-focused therapy. What are the takeaway messages? What is it? NAD is a medically supervised, naturally assisted detox. Why should a patient want it? Because it helps in reducing cravings. Will the patient get sick? If we had no clue what we were doing, yes. Lucky for you, we know that we need to control the rate of administration. Does it work? Yes, the research states over 80% report reduction in cravings. Our data reports 90% success rate in reduction of cravings. Let's go over a little bit about the post-acute withdrawal symptoms or syndrome. Pause can last for years, reinforcing dependence and usually leading to relapse. Some of the symptoms are anxiety or depression, where a patient feels dysphoric, irritable, their inability to feel pleasure from anything, drug craving, and cognitive impairment. Some of the positive symptom reduction you'll see among schizophrenic patients: anxiety, depression, bipolar, PTSD, chronic fatigue, fibromyalgia, chronic pain. How will this help our patients? NAD facilitates the production of energy. It raises the level of dopamine and serotonin. It minimizes withdrawals, restores clarity, eliminates cravings. It has a very high success rate and no dangerous side effects. What does it look like? It's natural protocols of amino acids, minerals, vitamins, and cofactors which accelerate repair of damaged areas of the brain. It's administered through a combination of oral and IV therapy. Ideal treatment is for 10 days, each lasting between 5 and 8 hours. A follow-up booster lasting between 3 to 5 hours is suggested once a month for the first 6 months, but it's not required. Follow-up appointments include evidence-based behavioral therapy, dialectical behavioral therapy, and a solution-focused therapy. The patient intake process is very similar to the process we use for our dual diagnosis patients and mental health patients, where a NAD patient comes in to complete intake and general admission paperwork, which includes informed consent, patient rights and responsibilities, HIPAA, and consent for NAD. We're also conducting history of their current medication and supplements, physical and labs. Patient is scheduled for medical clearance. The medical director, Dr. Snyder, will prescribe the drug, dose, and route of delivery and frequency. It is the responsibility of NAD clinic staff to administer all medications. Any medication administration will be properly documented in the EMR. 2 patient identifiers will be utilized when drawing and administering medication. What is it like for your patients? What are some of the nursing considerations? Chest pressure, sinus pressure, abdominal pressure. Clients with pre-existing medical conditions such as DM need to be stabilized prior to beginning detox. Conditions are not contraindicated. However, if the patient is not stable and requires medical attention, the detox will be disrupted. It is recommended not to dispense or continue the use of medications. Why NAD? because it's drug-free, it's evidence-based, minimizes pause, it eliminates cravings, it reduces anxiety, reduces depression, it normalizes the stress responses, and it promotes motivation. During the nursing orientation, these are the things that would be covered: neurobiology and pathophysiology of addiction, overview of patient process, preparation for new patient admission, administering protocol, substance and detox overview, supplement usage overview, nursing care protocols and procedures, combative patient IV infusion days. On day 1, patients will be explained the protocol, hydrate, compress, physician will be called if patient cannot get IV started. Now the IV nurses we have currently are nurses from a mission hospital. On day 3, day 5, or day 10, patient will obtain drug toxicology. A craving scale questionnaire is going to be used. Patient will be scheduled for booster. Upon discharge, administer home instructions, which will include diet, rest, activities, refer to appropriate level of care. What's the take-home message? Individual health evaluation, treatment tailored to patient's needs. Patient will stay in tranquil residential homes. A lot of rest and personal care will be provided for the patient during that time. Nutritional meals and 24-hour supervision. As needed, prescription medication for remaining detox symptoms. Where and how much does it cost? It costs a patient about $1,500 per day. The boosters on the first day is $500, second day onward is $900. We're currently servicing patients in the NAD home, which is located in Camino Capistrano, San Clemente, California. The exciting news is we're going to have a second one open in Pompano, Florida Beach. Florida. What are the benefits one more time? NAD facilitates the production of energy, raises the level of dopamine and serotonin, minimizes withdrawals, it restores clarity, it eliminates cravings, it has a very high success rate and no dangerous side effects.
So I'm asking for everyone's support and help in this program, and I appreciate the time you've given, and thank you very much.